Hi, everyone. It's Krista Stark. I'm the Chief Strategy and Development Officer for Health Pro Heritage, and we're thrilled with the news of an expected FDA approval for a COVID-19 vaccine as early as Friday, December 10th. As essential healthcare workers, our therapists will be among the first Americans with access to the vaccine, and our staff will be encouraged to participate in site-of-service vaccine clinics as soon as supply is available. We welcome the opportunity to do our part to assure the safety of our staff, patients, and families, to help create herd immunity across the country and ultimately contribute to the end of the pandemic. We will continue to provide information as soon as it becomes available, but in the meantime, we've prepared a short video featuring Dr. James Avery, our medical director, and he's going to walk through the current state of the pandemic, what we can do to contribute to its end, and also spend some time explaining the vaccines and how they work and the related clinical efficacy. We invite you to visit our resource page on our website for further information and hope you enjoy this video.
Great. We can go ahead and put the slide up. So great to be here. Everywhere I go, the main questions people ask me is, when will the pandemic end? When will it end? So I've done tremendous amount of research in medical journals, New York Times, Wall Street Journal, Washington Post, just looking health affairs, just looking for when will this thing end? So let's go to the next slide and let's talk about this. There's two basic ways that this thing might end. One is two ways to define it. One is the epidemiologist end, and one is the social scientist end. Okay, and the key factor when you think of these is the vaccine. You'll see how this plays out as we go on to the next slide. Well, let me see what we got there. Yeah, there we go. So the epidemiologist then, that's when herd immunity is achieved. And then the social scientist then, when some form of normality, when things get back to normal, you know, sports stadiums are filled, restaurants are packed, factories are humming, all those kind of things. Let's go to the next slide. So an epidemiologist then is defined by herd immunity. And that's when you have enough people who have immunity that you won't get widespread outbreaks. Now, when you look at the research, people might say 30 to 70%. What's the key number? How many people does it take to prevent widespread outbreaks? Now, if you live in New York City, high density, the number's about 60, 70%. You live in Nebraska, it's about 30%. So what we need is herd immunity. That's when the epidemiologists say it's over. Doesn't mean there's no infections. There might be occasional infections here and there, but there won't be these widespread outbreaks. Okay, next slide. So how do you add it up? How do you get this number that we need, this 30 to 70% number? The number of people vaccinated, plus the number of people who have immunity because they've already gotten the infection. That's around 15% right now. Plus the number of people who have cross-reactive immunity, meaning we now know some people have had a coronavirus in the past and it's protecting them from this one. So the key factor, so natural immunity, the one in the middle is 15%. Cross-reactivity, we think about 5%. It would take 7 years for us to get herd immunity in the United States if we didn't have the vaccine. The vaccine is the key to ending this pandemic. Next slide. When's that going to happen? Well, if in fact we have public confidence, if we have people taking the vaccine and the vaccine distribution goes well, and we're going to talk about the vaccine in more detail, it's going to happen in the summer. This is my prediction for you, that the pandemic, as defined by epidemiologists, will end in the summer. The New Jersey beaches will be filled. People will be in the Independence Day parades again. Picnics will be going on. Lake George will be filled with boats. However, wherever it is in your imagination for the summer, that's when it's going to end. Next slide. So midsummer, herd immunity is done. There will be some infections, no outbreaks. Now, the social scientists define it a different way. Again, they say it's when things go back to normal. And that depends on public confidence. When do people have less fear and more confidence, they can attend a sports stadium, that they can go to a full restaurant, they go back to the gym. When will that happen? That's the second question. Next slide. So this depends on a couple things. One, the same things we already talked about, the vaccine, the natural immunity, public compliance. In other words, all of us feel more comfortable if other people are wearing masks. That encourages us to go out. If we have advancements in therapeutics, less hospitalizations, less deaths, if we have a rapid, accurate testing and no term sequelae. Now, let me talk about the advancements in therapeutics for a second. Just in the last 2 weeks, we have had major releases of significant monoclonal antibody treatments. These treatments look very effective. So we're going to see some improvements. Let's go to the next slide. Now, if you look at this slide, these things are matched for time. On the left left graph, it's the number of cases. On the right side is the number of deaths, and they're matched for time. Notice how even with this recent surge, deaths have gone up, and they've gone up a lot recently, but not nearly as much as the surge. Meaning we have a lot of good reasons to say we're starting to get a handle on treatment. In the beginning, we overtreated people with ventilators and certain medications, and now we're getting a better handle on it. Next slide. And here we see declining death rates, 7% initially, 1.7, 1.5. It's probably going to be under 1% probably the next month or so. Now, what's the death rate from influenza on an average year? Somewhere around 0.4%. So most likely this thing will be double the influenza rate. But if you're under 30, it's almost 1/6 the influenza rate as far as deaths. And if you're over 70, it's 1,000-fold higher than it is for those under 30. So we see the big change. Next slide. So based on the social scientist end, I'm telling you it's going to be spring. In the spring, things are going to go back to normal. In the summer is the official end of the pandemic. That's, I think, if you go into strategic planning, you're planning your vacations, you're planning a cruise, I think you can think in these terms. Next slide. Now, the key thing is there's some unknowns here. My ship could be sunk by a couple of things. One is the holiday surge. Are we going to have a surge on top of a surge? I don't think so, but we might. And I think we're going to see a lot more cases and deaths in the next couple of weeks. But I don't think it's going to be a surge on top of a surge. We know we've had successful development of a vaccine. How is the distribution and launch going to be handled? And Hillary will give us more about that soon. But will people accept it? And then what are the other immunities? And finally, how's the media going to approach it? Are they going to highlight every single side effect, or are they going to emphasize the number of people that are being saved? So again, midsummer for the social scientist and for normality in a sense, and mid-spring and midsummer for herd immunity. Next slide. Let's talk, because now what's the key factor when you're listening to me? It's the vaccine, right? A safe and effective vaccine moves those dates up even more, and how well it's accepted. Let's go to the next slide. So how does a vaccine work? Typically, we have a germ or part of the virus. We make sure it's not infectious, and we inject it. And that's what makes them so powerful. You never have to get the infection. You produce the antibodies, just like if you were exposed to the disease, but you don't have to get the disease first. That's how vaccines in general work. These new vaccines are even more powerful in many ways. Next slide. I'll tell you about that in a second. So the key thing has been this spike protein. On the coronavirus surface is a spike protein, and there's multiple areas on this. We have been able to isolate the protein and even create the messenger RNA that tells the cell to make this protein so we can then have antibodies against it. It's incredible what's happened in this. In addition, the spike protein, as you can see in this sort of simulated diagram, this spike protein is all over the place. Even if we have significant mutations of the virus, this spike protein is not going to change dramatically. It's always going to be present. So that's how the vaccine works. It's simple. Neutralize the antibodies. Next slide. So this is what happens. The virus gets near a human cell, and your own antibodies, which were caused by either an infection or the vaccine, block it, and it cannot get into the ACE receptors. ACE receptors are the key. They're located in the kidney, located in the gut, located in our lungs, and that's where the virus does its most damage. And the antibody blocks it, just like a football player blocking somebody from getting to the quarterback. Next. So in a sense, the virus becomes like a gun without bullets. The virus is there. It's quickly eliminated by the body through the liver and kidneys, but it doesn't do any damage. It's just there. Next. So let's look at these things very quickly. The COVID-19 vaccines, the question is, how do we get the immune system stimulated? And we see there's 5 basic ways. I want to talk about the last one the most because the Pfizer vaccine is coming out next month and the next week, and the Moderna one will be maybe at the same time or even shortly thereafter. The messenger RNA is one of the beautiful things here, is that we are not injecting any virus or a part of a virus or even a segment of the virus. We're injecting the messenger RNA. Therefore, and I'm hopefully answering some questions already, we never have to use a human cell. There is no fetal tissue being used in this. Some people are worried about the abortion issue. There is no abortion being used to create the Moderna or Pfizer vaccines, and it's a very select way it's developed. Let's talk more about that. Next slide. So the technology was already in place. That's the beauty of it. And it can't enter the nucleus like DNA vaccines. And it leaves the bloodstream in a few hours. It can't infect anybody or anything. And we're getting B cells and T cells. In fact, I was on a call yesterday with my own company, and people were saying, I don't trust the vaccine because it's been done so quickly. Let me explain in 3 minutes here why it happens so fast. The normal vaccine takes 10 years. Number one is this reason, the messenger RNA technology. It was already in place. All we had to do was plug in that surface antigen, that picture I showed you, number one. Number two, we had NIH didn't make the manufacturers find volunteers. They put it on a website on Friday, this is back in July, asked for volunteers. They had 130,000 volunteers by Monday. We've never had that many volunteers sign up so quickly. The third reason why it's happened so quickly is that they did what's called at-risk manufacturing. Normally, you create a vaccine, you make sure it's safe, you test it, and then you manufacture it. The federal government paid for it to be manufactured right in the beginning, at the same time it was being tested. And then they said, we're going to throw it all out if it doesn't work. And the fourth reason is, and this is the strange one, the COVID surge helped the vaccine manufacturers. See, if you try to test a vaccine and you don't have a lot of infections, it takes forever to figure out if it's working or not. But when you have a surge, you have a lot more people getting sick and you have a lot more people who could be protected. So those 4 reasons are why it came out so quickly. Not one of them, not one, compromised safety. Next slide. The other thing I like about these vaccines, everyone's being tested for at least 30,000 people. They just didn't look at the antibody production. They wanted to make sure people actually had less infections. It's been so safe, it's amazing. And the efficacy is 90+%. I would ask Hillary, but I don't want to embarrass her. What is the efficacy of a normal influenza vaccine? You know, 40%. On a great year, it's 60%. On a bad year, it's 20%. Nobody in their wildest imagination imagined that we'd be at 90% effectiveness. And that was because of that surface protein that I showed you earlier. It's an amazing story. Scientists to this are saying this is almost miraculous that we were able to get this surface protein and have the messenger RNA antibodies. Next. I listed this just to give you an idea. We have 55 vaccines in the US, 55 different vaccines. We have a lot of experience. This is not like we don't know what's going on, what's happening, what we're doing here. And that should give you confidence. The other thing I should mention about the FDA, every one of your meetings has been live streamed, meaning you can go on, you, me, anybody can go on and listen to scientists debate these vaccines. It's been amazing. I've been on these sessions. It's been transparent and not affected by politics. Next slide. Also, we talk here about the efficacy. I said it's 90%. I compared it to the flu. And again, incidence of side effects have been minimal, mainly muscle aches, fever, some headaches. And again, you cannot, let me repeat this, it's impossible to get infected by this thing. There's no virus particles being used. There's not even a part of a virus that's being used. This is amazing technology. The efficacy and the safety is remarkable in every way. I saw an article recently in the New England Journal. One of the scientists who's not used to hyperbole said it's astounding that we have this efficacy and this safety. Next. So the launch and distribution, the CDC came up with 4 ethical principles, and I think we've seen it played out. Who would have guessed that nursing home residents would get it first? I mean, that's ethical, but that's where we're saying who's vulnerable, who's needy. Healthcare workers, number one, we expected that. And it's exciting to see this thing being distributed in the proper way. Next slide. So what's the key ingredient to ending the pandemic? A safe and effective vaccine that is developed and launched well. Then I want to highlight the second part, and it's accepted by the public. Next slide. That's the bottom line. But look at this. So they asked adults 50 to 80, said, would you get the vaccine? This is a recent study. 20% said as soon as possible. By the way, I'm in that 20%. I'm personally in that 20%. 46%, well, let somebody else do it first. And then about 15% said, I'm not going to get it at all. This to me is just so surprising given the science and the experts that we're seeing behind this. Next slide. So nursing home staff was surveyed. 26% said they would wait, not want to get the first one. 18%, they're not sure they'll ever get it. 12% said they would refuse. So you see folks having some resistance to it. And the reasons, I was on calls yesterday, are quite varied, and many of them not really based in science. Some of it is based in some conspiracy theories. Some people thought it was from abortion material. Other people thought that it was politics, that President Trump had pushed it. And I just, those things are just not the case. And I can say that honestly. Next slide. So personally, my mom is 90 years old. I want her to be the first person for the vaccine, and I would love to be second. And I want you to think of it in those terms. What would you do and what is best for all of us? And just think about what happens when you get the vaccine. You don't have to be tested anymore. I heard one airline say they're not going to allow people, only those who get vaccinated, to board the airline. Suddenly, things are changed. You can't infect anybody in your family anymore. You can't infect your coworkers, your colleagues. Next slide. So here's the summary. I want you to grasp 2 thoughts at once. First, we have never been closer to defeating the pandemic because of this amazing success. Just a few months from now, it's not that far away, mid-spring for the social scientists, and mid-summer, again, things are going to be humming if the vaccine gets enough people taking it. Secondly, though, at the same time, we're going to have some days and weeks ahead of lots of new infections. But the good news is the sun is coming out. Spring is not that far away. Summer's not that far away. We're We're right on the cusp of the pandemic.